Hyponatremia is a clinical and laboratory diagnosis, another radiological one. As discussed in the previous vlog, hyponatremia plays a role in the pathogenesis of MERS, caused by increased levels of vasopressin or antidiuretic hormone. And I want to show a very basic picture of the kidney, although it is brain bit by bit, where you can see that in the urinary system of the kidneys, there are about 9 different aquaporines. You can see the glomerulus here, Henle's loop with the countercurrent principle, and the collecting duct where water is reabsorbed from the pre-urine. And aquaporine 4 is present in the collecting duct, so it's not only present in astrocyte and feet. And aquaporine 2 is mainly influenced by the antidiuretic hormone. So if there's more water reabsorbed from the urine back into the blood, the level of the electrolytes goes down in the blood, the concentration of the electrolytes. And the brain wants to maintain an equilibrium. So if there's a lowering of the concentration of electrolytes in the blood in hyponatremia, the brain starts to absorb water to have the same concentration as the blood. And the water is mainly absorbed by the astrocytes, and they swell, and the neurons are relatively preserved. So the astrocytes once again take care of the homeostasis of the brain, and they protect the neurons. If the hyponatremia persists, the brain starts to lower the concentrations of electrolytes in the brain as well, and also secretes osmolytes. And one of the osmolytes that gets excreted is glutamate, which is also a neurotransmitter. So the lower level of this excitatory neurotransmitter in the brain explains part of the neurological symptoms in chronic hyponatremia. The level of antidiuretic hormone is also influenced by medication, not only anti-epileptic drugs, but also by selective serotonin reuptake inhibitors that are prescribed in patients with depression. And this is a very nice case report where they had sequential CT scans and sodium levels from the laboratory in a patient in her 70s with a depression that had started selective serotonin reuptake inhibitors, and she came to the ER with confusion and a very low serum sodium level. And on the CT of the brain you could see there was diffuse edema and swelling. They corrected the sodium very carefully, and after 60 hours she was alert again and her brain CT had normalized. You can see the ventricular system and the insular system much better as well, and also the basal cistern and the arachnoid spaces surrounding the brain stem have increased. Not all parts of the brain respond the same to hyponatremia, and there has been a nice article of a study done in pigs published in 2010, and they had control pigs and hyponatremic pigs, and they looked at several brain regions and at the muscles of mastication. You can see that in pigs the thalamus is located very low in the brainstem in contrast to humans, and this is a little bit of white matter. And if you compare the hyponatremic to the control pigs, you can see that the thalamus is much more influenced by the hyponatremia than the white matter, and that there's also some response in the muscles of mastication. And with these regional differences, we can look at the osmotic demyelination, which we will discuss next time.